I'm here today with my colleagues and regional sponsors of the Accountable Care Promotion Act. Let me give you a little background. First of all, I want to thank Earl Pomeroy for working so hard with me, and our co-sponsors who will be speaking, Jay Ensley, Brian Higgins, and Ron Kind, about this legislation. And we serve on Energy and Commerce and also on Ways and Means, which committees, as you know, are going to have major jurisdictional responsibility for healthcare reform. My experience in healthcare is as a Senate President in the state of Vermont. And as a Democrat, my colleagues and I were always focused on access, trying to make certain that folks who did not have healthcare would have it. When we were having our political battles in Vermont about healthcare, we had a Republican governor and his colleagues were primarily focused on cost. At a certain point, we reached across the aisle, shook hands, and understood that we were both right, that the path to greater access was through cost containment. And what we did in Vermont, where we have about one of the highest rates of covered individuals, and we have one of the lower per individual spending, is focus on how to reform the system of delivery of care, not just how you pay for care. And we did such things as establish a blueprint for health, which is focused on providing better ways, more efficient ways to provide care for folks with chronic illnesses. There's 6 chronic illnesses that account for about 70% of spending. But also, we started working with Elliot Fisher and folks at Dartmouth who have done extraordinary studies that are really quite shocking when you look at it. They have been able to investigate healthcare spending in the Medicare population by regions, and they have found, and it's really beyond dispute and documented in the Atul Gawande New Yorker article that is so much part of the political discussion now, that in regions where you have the highest spending on healthcare, you oftentimes have the worst outcomes. And in many regions where you have the lowest spending, you have the best healthcare outcomes. And what it says, at first may seem stunning, but in fact makes sense, because it is about how care is delivered that makes a difference in what the outcome is, as well as the cost. And the regions that have had the most success have, in effect, accountable care organizations. And that approach provides incentives for rewarding quality as opposed to volume. And the fee-for-service approach to medicine is an incentive to do more, whether it's needed or not. And it results in excessive spending that we can't afford, and ironically, outcomes that are less than desirable. The intention of our legislation is to provide incentives to promote better health care. And the tremendous link is that if we accomplish that, we're going to be able to lower cost. All of us are unified by the desire to deal with the cost side of healthcare. I'm going to turn this over now to Earl,
we'll come back.
And you'll come back. Thank you.